Good afternoon. This afternoon we're going to talk about using your drug book. This is an example of the drug books that y'all will use in the skills lab. You may have actually bought another one that's on your book list, and that is fine. They are all basically going to contain the same information, with the exception when we get to IVs, your IV drug books will contain more pertinent information to IV specific drugs. But for general purposes, we're going to talk about using your basic drug book. We're going to look up ANSEF. Most of your drugs will be found alphabetically in your drug book. However, ANSEF may be the trade name, and that may not be how it's listed. They're usually listed by their generic name. So we're going to turn to the back of the book and use the comprehensive index. We're going to look up ANSEF. It says right there that ANSEF is on page 283. We have now turned to page 283, and we're just going to come down. And here it is right there, ANSEF. I see that its pharmacological classification is that it is a cephalosporin, a first generation. You see that there are other names. Then we look at its classification. You will need to know that. It is an anti-infective, so we give it when someone has an infection, and its pharmacological classification is a first generation cephalosporin. Then we need to look at its indications. Treatment of the following infections caused by susceptible organisms. It can be given for skin infections. Sorry, the camera is wanting to move around on me. Such as wound infections, for pneumonia, for urinary tract infections. So there's many types of infections it can be used at. For bone and joint infections, what you need to know is that it is used for bacterial infections as an anti-infective. It is not effective for the treatment of meningitis. Then we want to look at its action. You will need to know this because you want to know, how does that medicine accomplish that goal? How does it act on the patient's body? So right here it tells you that the cephalosporin or the ANSEF binds to that bacterial cell wall membrane and causing that cell to die. So we want it to kill the susceptible host or bacteria. That is the primary thing that you need to know about it. Absorption. It is absorbed by the oral administration route. It can also be given IM, and then you might see later that it can be given IV. It is metabolized. This is important. Metabolized and excreted by the kidneys. So if a kidney had an elevated BUN and creatinine, that would be something that we would have to look at. Did they need to receive this antibiotic? And sometimes the benefits outweigh the risk, but it's certainly something you have to look at. And you might want to look up their BUN and creatinine if they've had one done prior to administering this medication. And it gives you the different routes, and the different routes, how rapid the peak and the duration is. So we see that if they're taking this PO, it has a rapid onset of 1.5 to 2 hours, and it lasts for 12 to 24 hours. If you're given this IM, it also has a rapid onset of usually a half an hour to 2 hours, so even more rapid, and it lasts 6 to 12 hours. Then let's move over to the other column, and we need to know about interactions. We also need to look at some of the adverse reactions. That was down at the very bottom of the other column. The adverse reactions and the contraindications. Let's look at the contraindications. And precautions. You see right away, contraindicated, hypersensitivity to cephalosporins or hypersensitivity to penicillin. So if this patient had a penicillin allergy, we would not administer the Ancef because it's contraindicated. It can cause renal impairment, and I'm going to look at some other things here. Adverse reactions and side effects, things you need to watch for in high doses. It can cause diarrhea and nausea. Many of our strong antibiotics given in high doses over long periods of time can wipe out all the good bacteria in the GI tract and cause diarrhea, nausea, and vomiting, cramps. It can cause Stevens-Johnson syndrome, which is sloughing off of the skin. That's a severe, life-threatening reaction. It can cause rashes, urticaria, agranulocytosis, another very severe reaction, breaking down of the white blood cells or destruction of the white blood cells. If we give it IM, we want to look for phlebitis at the IV site and irritation or pain at the IM site. And here you might look at drug-to-drug interactions. We see loop diuretic. Lasix is a loop diuretic. Okay? So we might read further about what those interactions are with Lasix. And how is it usually given, or how can it be given? It can be given PO to adults, and it gives your dosing. It can be given to children, and it gives the dosing for them. And then it says, it repetitively has said, right, that it can cause renal impairment. So that's something that we really, really need to pay attention to. It can also be given IM or IV. Often for more moderate to severe infections, it's given IV. And there's our IM and IV information for children, for neonates. There's the renal impairment warning again. So we see that that is a common thread throughout here. Now let's go to the next page, and we're still talking about our cephalozoans or Ancef. There's renal impairment again, so we get that's a strong, important thread. Nursing implications. What do we need to assess for? We assess for infection, right? If they're on it, then they probably have an infection, so we need to be assessing vital signs. If they have any drainage from wounds, if they have a respiratory infection, the sputum, the color of it. If they have a urinary tract infection, their urine and the color. Also remember that we've seen renal impairment throughout. So we would want to check a BUN and creatinine if they'd had one drawn. We would want to monitor their urine output to make sure that it was still adequate and not becoming inadequate. The kidneys were not shutting down. We would want to monitor their stools for possibly any blood. And we said that it can cause diarrhea and nausea and vomiting, so we would monitor them for diarrhea, nausea, and vomiting. If we see, again, if the person has a history of penicillin, we would not monitor it. We would not administer it. And then we see with the first dose may be given, and we want to monitor them closely. We're going to observe that patient for any signs and symptoms of a new rash or pruritus, for laryngeal edema or swelling of the airway, wheezing, which is another sign of respiratory distress or difficulty. If any of these occurred, we would discontinue the drug right away. Someone would notify the healthcare provider. You would stay with your patient and administer any medications like epinephrine, Benadryl or any antihistamines that were ordered. We would monitor them very closely. Now, as you saw, the primary things that we looked up our drug in the comprehensive index. We found which page it was on. We saw that it was a cephalosporin, that was its pharmacological classification. We saw that it was an anti-infective, that was its therapeutic classification. We looked at any contraindications and saw right away that if they were allergic to any cephalosporin or penicillin, we would not administer that drug. Then we looked to see how that drug could be given, what its indications were. Why would it be given? We saw the many types of infection that it could be given for. Then we looked at the action. How does that medicine work on the body to accomplish its goal? Then we looked at the different routes, their onset, and how long the medication lasted. We then looked at contraindications and precautions. Again, we saw that alert for a penicillin allergy or cephalosporin allergy. We wouldn't administer it. We also saw a common thread of warning us of the potential for renal impairment. So we would want to check a BUN and creatinine if they were available, especially if our patient had history of renal impairment or any type of renal failure. Then we looked at the adverse reactions and the side effects. What would we need to monitor our patient for? We looked at interactions. Which drugs could it possibly have an interaction with? So you have to know all the drugs that your patients are on, and could any of these drugs interact with each other? Then we looked at the common routes and the dosages. We saw that it was available from anywhere from adult to neonates, whatever age our patient might be. Then we looked at nursing implications, which is very important. So if they've got an infection, we need to be monitoring their temperature, their vital signs. We saw that we need to monitor their renal function with ANSEP or cephalosporin. We also saw that we need to monitor their stool for any blood or diarrhea, because it can cause diarrhea, nausea, vomiting. We would assess them for those things. Then we also would assess them for any rashes, respiratory distress, swelling of the airway, wheezing, which is another sign that we have respiratory compromise. And that we would stay with our patient if they had any of these signs, call for help, administer any meds ordered, but before we even called for help, if we saw the least sign of any respiratory distress, we would discontinue the drug immediately, stay with our patient, and call for help. And you can use the drug book in this way to look up any drugs. We encourage y'all to make drug cards ahead of time. You can also highlight the key things under your drugs. So highlight the classification, highlight the primary nursing actions, highlight the contraindications or sensitivities, highlight what you need to assess for. Also encourage you to tab your drug books. You can use tabs and then have them easy to find. You can, tab them and write Lasix or ANSEP or digoxin. Often your instructors will provide a list of drugs commonly given on the unit you're going to be on. Now that doesn't mean it's an exclusive list, but some they know are commonly given. It's a good idea to look those up before clinical starts. Tab your drug book with those. Highlight the key points of each one of those drugs so you're prepared and ready and can look it up quickly if you have the opportunity to give those medications. I hope that this has been helpful.